Good evening, everyone. Welcome to tonight's show. I want to begin by acknowledging we're gathered on Treaty 6 lands and the traditional land of the Métis, Dakota, Lakota, and Saulteaux, and we want to affirm and reaffirm our relationship to one another. My name's Lenore Swiston, the media host of Civically Speaking, and I'm here today with my dear colleague, Anika Misha, co-host of The Voice of Saskatoon. Thanks for being with me, Anika.
Yeah.
Yeah, for sure. And behind the scenes, we've got Ian Roach, Dennis Gilbertson, and Deborah Huback of No YXC, who are carrying all of the production and the direction for us. So that's pretty good too, eh? So we're all here committed to offering local community content through streaming channels and media just like this. And of course, my home community radio station, CFCR. So be sure to check all our stations out. And thanks for tuning in. Anika, over to you for the next part of this.
Perfect. Thanks, Lenore. So today marks the 4th panel session in our series. Our last one was in October. So we would like to now welcome our panel members. We have Pamela Goulden-McLeod, Director of Emergency Planning with the City of Saskatoon. Welcome, Pamela. Perfect. We have Dr. Kendel, retired physician, former registrar of the College of Physicians and Surgeons of Saskatchewan, and current healthcare consultant. Welcome, Dr. Kendel.
Thank you.
Perfect. And lastly, we have Dr. Muhajarine, Professor and Chair of Community Health and Epidemiology with the University of Saskatchewan. Welcome, Dr. Muhajarine.
Thank you. Good to be here.
Yeah, our pleasure. So we sent heartfelt regrets from Dr. Hassan Masri, who's a critical care physician and associate professor of medicine and critical care at the University of Saskatchewan, and Tracy Mugley, executive director of St. Paul's Hospital, who were not able to make it tonight, though hope to be part of our next panel discussion. So welcome, panel members. And again, thank you so much for taking the time out of a very busy schedule to be here with us tonight. This forum will be conducted in essentially 3 key parts. First, we have 3 questions we'd like each panel member to respond to. Second, as time provides, we want to open the floor to our viewing members who joined us either through Facebook or joined us through a Twitter conversation using the hashtag COVID-19YXC. Everyone will be required to have a Facebook ID to watch and ask questions on Facebook. And 3, we will give our panel members a minute or 2 to share any closing reflections or guidance going forward. Our role as hosts will be to keep the flow of conversation going and queue up and ask questions to our panel members. And please, to all our viewers, use the group chat function to share any comments, questions, or any feedbacks. And we will do our best to respond to as many as we can. And again, thank you so much, panel members and audience, for joining us for tonight's show. It is being recorded, so will be available for viewing afterwards through all our social media links on YouTube, Facebook, on Facebook through the Voice of Saskatoon Facebook page, Civically Speaking Facebook page, and No YXC. Lenore, back to you.
Yeah, thanks so much, Anika. Okay, we're going to set some context here. So want to just throw out some information before we get to the questions, because here we are. Today marks 21 months or 92 weeks or 643 days since the pandemic was declared by the World Health Organization. Okay, that's a long time. In our province to date, we've had approximately 81,961 cases of COVID. Sadly, 941 people and their families have been affected by passings away attributed to COVID. In Canada, we've had over 185 million cases and almost 30,000 people who have passed away attributed to COVID. Currently, we have 538 active cases counted in our province, 62 of those cases being recorded today, with 69 new recoveries reported today as well. Today in our hospitals, there's 105 people sick with COVID-19, and 33 of them are currently in the ICU. Attributed to COVID-19 since the start of the pandemic, as shared, has been like 900 and some people passing away, and our hearts go out to all the families affected. On the vaccination side, out of the total eligible population, 74.7% of eligible have received 2 jabs. So 74.7% who've received their, what we call the 2 jab or full vaccination to this point that we've been calling it. And what we know today is there is a new variant that has hit the news, Omicron variant, that has us all a little more alert as we head into the holiday season. We provide this as a little context for our discussion today as we do this 4th panel session here during the holiday season. So Anika, back to you to kickstart this off with our panel.
Perfect. Thank you, Lenore. So, panel members, starting with Dr. Muhajarine. Over the next 2 to 3 minutes, please share your perspective and experience regarding the current situation around COVID-19 in our city and province as a whole and beyond.
Thanks, Anika. Hello to everyone again, and really nice to be here and have a bit of a conversation. Honored to be amongst the panel members, and looking forward to a really nice chat this evening. Anika, the way that I would describe the situation right now is that in the national context of Canada, province of Saskatchewan is at a low point, of new cases, hospitalizations, ICU bed use, and deaths as well. Mind you, we had just come out of what I would describe as one of the most severe waves that any province had experienced during this 21 months, Leno. That's what I think I heard you say. And the 4th wave in Saskatchewan that began in late August and probably sort of went into that refraction time or the downward slope in early November, early to mid-November, saw our hospitals overrun, our capacity stretch absolutely to the brink. We had to call the Canadian services, to supplement our resources, and we sent patients to Ontario. The pandemic waves go up and down, and that is the nature of these waves. What in a way what goes up has to come down in this sense, and that is the way that pandemic waves behave. So we are at a low ebb, but Omicron is knocking on our door. And and I've been thinking, it is like unwanted holiday guest, unwanted, unwelcome, smelly, however you want to describe it. We don't want Omicron, to take hold in this province. So I think that there's a little bit of a lull in COVID numbers and in COVID buzz, but Omicron is changing it. And I think that we need to do more to talk about Omicron in this province. And we need not just only talk, but we do need to talk. We need to begin to have a conversation about, and that needs to be led by our leaders, political and public health and medical and social, and we do need to take steps right now, tomorrow, next week, in order to stave off any surge, any wave that might happen, particularly after Christmas. And so that's where we are. And I look forward to talking a little bit more about Omicron. I mean, it is actually proving out. I'll just say this, and then I'll stop. It is proving out to be as threatening or as transmissible and infectious as our scientists described it, about 2 to 3 weeks ago, in South Africa, with 50 odd mutations, which is probably 2 to 3 more mutations than any other variant during this pandemic, and about 30 of them in the spike protein. Why it's important is because that's how the virus gets into the cell. And so 2.5 weeks ago, there was a theoretical possibility that this particular variant will be highly transmissible, highly infectious, and maybe evade resistance or immunity, and also perhaps be more serious. And except the last piece, we don't know whether it is as serious as Delta is and was. But the two other points: it is highly transmissible, it is highly infectious, and it is evading antibody immunity, even among vaccinated people. And it's probably also reinfecting people who had COVID, before. So we can get into a little bit more detail on that a little bit later in our conversation. But Omicron is nothing to scoff at, nothing to minimize. It is highly, highly threatening, and I think we need to prepare, in our province, to face, this particular variant.
Thank you, Dr. Muhajarine. I'll go to Pamela now.
Thank you very much, and I'm really pleased to be here today to continue this conversation with everybody. With the situation right now, I just want to reflect when, Lenore talked about 21 months. That is a really, really, really long time. And typically, as an emergency manager and in emergency management, typically when we respond to an emergency, responding to something that occurs, an event occurs, and then we're responding, and then we're into recovery. With COVID, we're responding while the event reoccurs every single day. And so there really has been no break from the response. There's been no, now we can relax, now we can bring in reinforcements as far as, a change out in shifts. We haven't been able to do that. And I think that's for everyone. That's not just for our critical infrastructures or SHA and all the staff. Everybody in our province has been feeling this for 21 months and responding while this event is still occurring. So there's no, normally in the middle of an emergency response, we can say, okay, we can plan for when the timeline's done. We don't have an end date for this timeline. And I think that's one of the really big struggles. And we've forgotten that we're in a pandemic, I think. I think that's key. We're starting to think this is normal. We're starting to think this level of response, this level of intensity is normal. And I'd have to say, one of the things I've been extremely concerned about is the level of fatigue in our community, the level of fatigue in our critical infrastructures, the level of the fatigue in the people doing this work every day, the level of fatigue in families trying to work this out and anticipate if their child's going to be self-isolating. It's just our whole community feels fatigued right now. And I think, we have to work so hard at being kind and gentle and thoughtful with each other during these times of fatigue and really remembering how exhausted we all are. For those of you in Saskatoon who know Kevin Cameron from the North American Center for Threat Assessment and Trauma Response, we've had him work with some of our critical infrastructure partners on how do we manage this level of fatigue? How do we manage this level of exhaustion and this level of traumatization of all of our organizations? And he has a phrase, and he keeps saying to us in multiple meetings, he'll say repeatedly, we're in a friggin' pandemic. And I think too often we are just going. And I just think we have to remember, we have to give ourselves the time to breathe, and we haven't had that. And I don't just mean the responders, I mean everybody, because from an emergency management point of view, in a major emergency like we're in right now, everybody's a first responder. Everybody has a role to play in mitigating this risk and being part of the response. And I'll say with Omicron, the one reassuring thing for me is that we know what we need to do. We know what works. We're not talking about creating any new. Like, I think back to March 2020 when we were all just unsure of what we had to do, and we didn't know what steps we had to take. We know what steps work. And so I know for our critical infrastructures, one of the we've talked about is, you've got to go make sure those hazard control plans are in place, make sure your business continuity plans are in place, make sure, that you've got your staff who are vaccinated or testing, but vaccinating, promoting the booster shots, the masking, all of these things, watching the gatherings, all of these things are so critical, and we know them. And so I think that's the thing. How do we help people continue to do the things they need to do when everyone's so fatigued? And so that's one of the things that we're really focusing on right now.
Perfect. Thank you so much, Pamela. I'll go to Dr. Kendel now.
Thank you, Anika. I'll just pick up on the reference Pamela made to fatigue in the system, and I'm going to talk a little bit about our healthcare system. So I'm thankful that we do have an integrated healthcare system rather than the 12 regional health authorities we had before, because it does enable us to take a more coordinated approach, to managing a major threat such as this pandemic. The health authority, the SHA, has over 42,000 staff working in a diverse array of roles. And I want to just talk very candidly about the fact that many members of that huge staff are quite exhausted. I would liken it to running an amazing endurance race, that has lasted now for 21 months, and thinking you're at the finish line, and then suddenly realizing that you may have to just start another race with very little reserve capacity left. During the course of this pandemic, the health authority had to ask and require staff to move into roles they weren't normally engaged in, which is also more stressful because you're on a learning curve all the time. And so I can understand why there is such exhaustion. So Nazeem mentioned that our numbers have come down, and last week, I think, it felt good. It felt comfortable, like we were sort of out of the major threat zone. And indeed, our government focused its attention on a plan to work on the backlog of surgical procedures that have been deferred during this pandemic. And as a citizen, you almost had a sense that we could now take a deep breath and, we were out of this. And then Omicron, which did, start elsewhere in the world, but is now definitely well rooted in Canada, came on the horizon. And I will just make the observation that because in our country, health is largely in provincial jurisdiction, provinces have taken quite diverse approaches to managing the pandemic. And I was pleased that earlier this week, our Prime Minister and the chair of the Council of Federation arranged a joint meeting between all the premiers of the territories and provinces and the Prime Minister to talk about what we could do to take a more concerted approach or organized approach to Omicron. And so our Premier Moe, would have been part of that dialogue. Today, I saw in the media many provincial premiers coming on media talking about the plans for the provinces. I saw chief medical health officers doing so. And I was deeply disappointed that our government did not make itself available to the media today to announce what its plans are. A member of the media reached out to the interim medical health officer with the SHA to get commentary. And then when he offered his commentary, Corey Neudorf, then the government issued a brief statement. And in essence, the statement simply says, we're waiting and watching. And I am very, very deeply troubled by this, because this has been our problem for quite some time. We wait too long, And as a consequence, we put people at unreasonable risk of harm, including death. And many of the deaths that have occurred would have been preventable if there had been action by our government earlier in August. And now we're in the very same situation where I'm seeing a failure to act decisively, and we need decisive action. And we can talk a bit more about that later in the program, but in simple measures, I think we need to rapidly expand the access to booster shots past age 50, where we're at now. Ontario announced today that effective Monday, everybody over 18 will be eligible for booster shots in Ontario. I think we need to go there as well. We perhaps need to consider policies around gathering sizes over the holiday period, because it's going to be very, very high risk. As an epidemiologist, my friend Nazeem actually gets access to lots of highly technical information that the rest of us don't see until maybe much later. So on Sunday, he got access to a report from Public Health Ontario, which I just saw online today and shared with the other panel members. And I think the most striking thing in that report is that in Ontario, Omicron is showing a 7.7-fold higher ratio of transmissibility than Delta. So even if the majority of infections might be relatively mild, when the transmission rate is over 7 times that we've seen so far, we are at very high risk of having our healthcare system overwhelmed again. And our staff are just not in a position right now to simply, pick up and enter the battle as they've carried on for the last 21 months. So this is a very serious situation. And I want to see decisive action by our government. I want to hear something tomorrow about what they're planning to do.
Perfect. Thank you to the panel members. Before I pass it on to Lenore, to all our viewers and listeners, please feel free to share any questions, any comments you have on the comments down below. Over to you, Lenore. I think you're muted.
Yeah, thanks so much. That was a double talk there. The famous words of the 2021 year. It's been all one year just mushed together, it seems, for many of us. As we noted at the beginning of this 21 months of COVID since this has started, I just wanted to acknowledge the fact of just how much I appreciate the context of the wisdom you have. We know a lot of people tune into the show on their own time because it's recorded. And I know this is going to be watched by a lot of people. Your peers will be watching it. Media will be watching it. And everyday folks will be watching it out of curiosity. But I also know this. People are tired. They're fatigued. And it's wearing on them. But, Nazeem, to start with you, and I know we're using first names here, but and I hope that's okay. But, Dr. Muhajarine, you are an epidemiologist. And as Dr. Kendel said, you're getting this information before any of us are. And to kickstart us off in this next thing, there is all this Omicron information out there, and it's coming from everywhere. And it's confusing. We don't know what it is. We don't know if it's bad. If it's, it's been likened in some channels to the common cold. We've heard from all of you so far saying we need to be alert to this very much. So what can you tell us and inform us about this variant and why it's important for us to understand about it as much as we can, as just regular residents and community people living our lives?
Yeah. So Lenore, let me sort of kind of organize my response into 3 parts, and those 3 parts are really, I think, what matters to people. People live their lives in their families, in the community, in province, and that is Omicron more infectious? Does it transmit more easily? And if you get it, are you likely to, be more sick with it? So that's the third one. And also the second part is Omicron able to evade vaccine-induced immunity or immunity that would have been acquired by just having COVID-19 previously. So again, infectivity, transmissibility, vaccine evasion, and really pathogenicity or virulency. Really, how bad could COVID be? That is caused by Omicron. So going back to just the variant itself, um, it it originated not from the previous 4 variants of Delta, Gamma, Beta, Alpha, this Greek Greek alphabet, variants, but apparently it would have evolved, way back, even about almost 2 years ago, around the same time the wild variant, the Wuhan variant, originated. So in that sense, it does trace a different evolutionary, path to the other 4 variants, that we have recognized. It is loaded with mutations, and some of these mutations we have seen in the previous 4 variants as well. Mutations that are in the spike protein, in the area where the virus uses to attach to healthy cells. So the receptor binding domain, or that area, particular area on the spike protein that attaches to the cell layer. And so there are changes to the virus that allows it to bind more tightly and able to get in more quickly. And once it gets into the cells, able to replicate more profusely. And so it does present a very, very sort of highly effective, it's almost like a super bug here in a virus to get into cells. So coming to the transmissibility and the infectivity, now we know that it is transmitting very, very quickly. In about 2.5 weeks, we have gone from just 1 or 2 countries in Southern African region, South Africa, Botswana, about 3 weeks ago, to 70 plus countries in the world. And in some countries, it is taken over. It has become more than 50%, of the variant, that is causing COVID-19. And probably in Ontario this week, it will surpass Delta variant, and that has gone from, it was on the 28th Sunday that the first 2 cases of Omicron was detected in Canada, both in Ottawa, travel related to Nigeria. And so that was only 2.5 weeks ago. And today, 2.5 weeks later, Omicron is probably the dominant variant in Ontario. And it is doubling every 2 to 3 days. Compared to Delta, which took maybe 5 days, 6 days, and Wuhan 10 to 12 days. So it's doubling so rapidly in terms of in terms of cases. So coming to the vaccine evasion question, we always knew that, and this was the biggest fear, that we are getting a lot of people vaccinated, and that gives us a sense of comfort, sense of protection, and sometimes leads to complacency. And we talked about fatigue as well. This is not a good mix, complacency and fatigue. So when we get our 2 doses of vaccines, we feel that, okay, we can now breathe. We can think about doing all those things we haven't been doing for the 21 months in this past 21 months. And then comes this variant, that can breach the defenses that our immune system accords us, to fight off this particular type of viruses. And we always knew this could happen. It was happening with Gamma in Brazil, last year. It happens with Beta, which was the previous variant in South Africa, they were found. And so we always knew that there could be a virus that can get around our immune system. And now we have it, and that is Omicron. So it is showing that it can reduce antibody neutralization, meaning basically the antibodies, plug up, the places where, the virus will attach itself to the cells. And so it's neutralizing, antibody by 40%, compared to Delta. And so it is evading antibody immunity. But immune systems are much more complex than just only antibodies. It has T cells, it has B cells. I've learned all of this from my colleagues in the past 2 years. I'm not a vaccinologist, I'm not a virologist, but just interacting even earlier today, this afternoon, with my colleagues in COVA-NET, Coronavirus Variant Rapid Response Network. They're basic scientists. They're now actually have the isolate, of Omicron, and they are going to do their lab tests of antibody neutralization and so forth and so on. They're going to actually use mice, to animal studies and all of that. This is all happening in Canada. And so coming back to the Omicron variant, so it is evading antibody immunity, but we have T cells and B cells that can protect us. And it seems that those two lines of defense, cell-mediated immunity, is holding against Omicron. But still, these are still early days as viral variants go. We are only 2.5 weeks out of since this particular variant was discovered. The biggest concern and the unknown is whether this particular variant will be more threatening to human life, to well-being in terms of actually hospitalizations and ICU bed use, overwhelming healthcare system once again, which has knock-on effects, not only actually taking care of COVID patients, but because we are taking care of COVID patients, we are not able to take care of people who need care for other reasons, even people who may have an accident, and injuries, So when we look at whether Omicron is creating more serious COVID-19, it doesn't seem to be creating. That is what we are seeing, but that doesn't mean that actually that it will not be serious down the road. I think it is still early days. The best data that we have so far on severity is from South Africa, because that's where it was found the earliest. And South Africa and Canada are two different demographics, two different populations. There are a lot of people who were probably infected with Delta and other variants in South Africa. Although the vaccination rate is only about 1/3 of Canada's, many more people are probably seropositive, meaning that they were probably infected, and they recovered from the infection and actually have this natural immunity, to variants, to this virus. That is not the case in Canada. And Canada has an older population in general, than in South Africa, and I think that we need to be looking at countries like Germany, Denmark, and UK in order to understand how severe Omicron might be once people get it. And I think it is still early days. We don't have enough data. But to really say that it is not going to be very serious, I think is, we have to stop it to think that we really can't, we really don't have the data, for that yet. And I think Dennis said, about, even I mean, it's transmitting so widely. So I mean, the cases are surging so much, and even a small proportion of those cases were to be severe, it is going to, it is going to have a huge effect on our healthcare system. And but what about actually people who are positive with Omicron and who cannot work, who need to isolate?
Mhm.
A child picks up Omicron, outside of their home, comes home. Now the whole family has to isolate. That means that,
Mhm.
that whole family will be taken out of their daily function. You
Mhm.
know, the mom and dad might not be working, couldn't work. If they have to
Yeah.
go outside the home to work, they're taken out of that, that activity. And everyone has to isolate for 10 days, And so the consequence of high case numbers is not only in the healthcare system, but it is in the families, it is in neighborhoods, and it is in our society. And that's why we have to not just only think about severity in terms of healthcare system. Even that alone is enough to, to really kind of galvanize us to action, decisive action, as we heard. But it also disrupts our lives, and continue to disrupt our lives, even
Mhm.
at late, at this late stage. I'm completely in agreement with Dr. Kendel. I was hoping that Premier Moore will have something to say to people of Saskatchewan, after having met with his counterparts across the country and the Prime Minister about what each of the provinces need to do to prepare them and to act and respond to this Omicron COVID-19, and that we did not see happen today. And would it happen tomorrow? I'm not
Yeah.
holding my breath,
Yeah.
you know. But we do need to demand our premier and our government actually move and take action. And I think we have to demand as citizens.
Yeah, thank you. Thank you for those comments, Nazeem. Lots to digest in what you just said, I'll tell you. So I know we're going to circle on this a few times because I know that the question around Omicron has come back in. And then as you said, there's a bunch of layers in this in terms of including the actions that are being taken here, right, locally in our own home, right? I want to build on this, Pamela. I know that, from the city of Saskatoon's perspective, as you shared earlier, we got to be thinking about this stuff. So here comes a new variant, right? As you said, people are unfortunately maybe normalizing this, thinking they may have a jab or two in their arm. All good to go. I wear my mask. That's what I've been told to do. As long as I've got that and I got my little Vax wallet, what's the problem here? Why are you guys talking about this even tonight? I just want to prepare for the holiday season. What's going on here? So, Pamela, what's the response that you have to this new variant and what's happening in your world as a result of that?
Well, Lenore, and I just want to thank Nazeem for mentioning. I think it's really important we focus on the health impacts of
Mm-hmm.
a pandemic, but it is those other cascading impacts that are more the realm of emergency management.
Mm-hmm.
And emergency management is an interesting field, and we typically, help coordinate the response to lots of different events and different type of events. And I'm going to share that after every type of an activation in emergency management, in any emergency management field, we always complete what's called an after action report, which looks at what went well, what could have done better, and what will we do differently in the future. And I just want to share, in every single after action report I have ever read in my life, whether it's a hazardous waste, whether it's a wildfire out of control and burn down a town, whether it's a shooting in Las Vegas, any after action report, the first thing that breaks down in any emergency response is communication. That is always communication between responders, communication between the leaders and the public, communication between the victims and the emergency responders. And that's always something that's highlighted that we need to do better every time.
Mm-hmm.
And I think one of the things that we've tried to do in our emergency operations center is always learn from after actions, always learn and improve going forward. And so I know we've done some learning through COVID as far as, communication that the city has shared. One of the things we've learned is that residents and people in Saskatoon tend to respond better to what they can do. Understanding what the restrictions are, but what can I do with these restrictions? How can I gather with my family? How can I be safe and still do some of the things? And so that's one of the things we've tried to focus on, is ensuring people are aware of what are the things you can still do and how can you do them safely, and how can you, go about your daily, role safely. And, that's one of the things we've been trying to do heading into the holiday season, is highlight some of the outdoor locations in the city of Saskatoon, outdoor activities in the city of Saskatoon. We've got we're a winter city. There's lots of opportunities, there's lots of things around Saskatchewan that are great to do. So really focusing on highlighting those things in Saskatoon that families can gather outside, which is a little safer than the indoor gatherings. Highlighting how can you create better ventilation in your home? How can you have your family members over and be safe? I think of the availability of rapid tests here in Saskatoon. You can pick them up at the Saskatoon Public Library. You can pick them up at the Chamber of Commerce. Having those rapid tests before you get together with your family, so you can confirm, we just took this rapid test. We can get together. I have a member of my family who has a significant issue. I'm fully vaccinated. I will continue to follow all the recommended doses around vaccination. But before I'm going to see my father, I'm going to take a rapid test because I want to keep him safe. I'm going to have the hard conversations with my family members who aren't vaccinated, or our friends who aren't vaccinated, about how we're going to operate this holidays. And we're going to gather as a family, but we're going to gather with people who are vaccinated, and we're going to gather and make sure doors and windows are open, and we're going to gather and make sure that we're rapid testing before we all gather, so that we can stop transition before it happens. And so I think that's one of the things we're trying to figure out, is with Omicron coming, how do we help people figure out how to live their lives and be safe? And how do we build on what we've learned about communication and continue it? One of the other things we know in emergency management is you can have two identical responses, and you can respond identically, and you can do the exact same steps all the way through. But if you're not communicating effectively, if one, you communicate effectively, if one, you communicate timely, and one, you communicate on a regular basis so people know what to expect, and you're open and transparent about that communication, and you just let them know what happens. Even if it's just, we don't know yet, we're going to get you the information, we have it. And the other one, the exact same response, you don't communicate effectively with the public, you're going to see a difference in how the public perceives those two activations and those two responses. And so I think that's something we've taken to heart, and working at communicating effectively with the public and with our staff in the city of Saskatoon. And so going into the holidays, I know our local medical health officers, the medical health officers have shared out a statement about, the holidays and what to do. And that's on the SHA site. And I'm not sure if that's a link we can share, but it's an excellent document. And it provides a great deal of information for people to read and understand. We've shared similar messaging with our staff. And I think that's the key, is how do we communicate, and how do we communicate effectively, knowing we're all exhausted. And I heard from many people today, frustrated with, what's going on with travel right now. People who have canceling travel plans yet again, canceling plans to go see, family members in other countries, and really discouraged and disheartened. So how do we help those people who are planning to go see their grandparents for the first time in 2 or 3 years? How can we help them find ways that they can connect, and ways that they can celebrate these holidays together? And so those are the kind of things we're looking at.
Yeah, thank you so much, Pamela. There was a lot of information there too. And for those that are tuning in, we're here with an awesome panel. Pamela Goulden-McLeod, here as the Director of Emergency Services with the City of Saskatoon. Dr. Dennis Kendel, who we're going to go to here next, and go back to Omicron and stay on that for a little bit, because that's a big one. And Pamela, you led right into that, because that's exactly it. What do we need to do as a result of hearing about that? Never mind just that. And of course, Dr. Nazeem Muhajarine, who's just given some really good information, layered information on just the technical aspects of this and why it matters, why this matters. So I really, really appreciate all three of you. Dr. Kendel, building on what you've just heard your two colleagues talk about, different aspects of this Omicron variant that's come in, and I know you've been following this and tweeting out about it and having conversations with people. Your thoughts on this and what we need to be thinking about?
Well, I'm going to ping off of Pamela's comments about the importance of communication. In a situation where there's uncertainty about the risk of something, I think it's important to be really honest with people about the possible risks and to help them understand what they can do personally to mitigate those risks. And then to actually, if you're in leadership roles in government or in a health setting, to take those steps in the way of policy that will protect people. So as a physician, I'm privileged, not every Thursday, but now most Thursday evenings, to participate in something called the Physician Town Hall meeting that's organized by the SHA, and physicians are welcome to log on and participate in that. And it is actually posted online at the SHA website. You can watch it later, and actually the media do follow up on it. But every time I sit in one of those meetings, I feel that I'm privileged as a physician to get much more detailed and very understandable information than the general public is getting. And that's where I feel we have failed in terms of communicating, in an intelligible way with all of our citizens. And I guess one of the things that I am concerned about is that in the absence of good communication, people will get a sense of futility. They'll think there's no point really doing anything anymore. Just let's let it rip. Let's let it go through our society. And as you know, there are some people and proponents of that concept, which unfortunately is a very tragic concept. But there are people, I think, who are feeling that they've reached the end point of their willingness to actually comply with public health orders. And in the UK right now, you're seeing the government facing rebellion within its ranks, actually. And we have some of that in Saskatchewan, sadly, where there are forces that I think often modulate our government's response in order to appease people who have taken an anti-vax, mandate approach. And I think we also have to be honest with ourselves. There's various metrics of immunization rates, obviously eligible population and different subsets. But we have, if not the lowest, still among the lowest immunization rates in the country. That makes us more vulnerable. And it's interesting, while there was amazing uptake of childhood immunization at the outset by the parents who are avidly concerned about their children's welfare, we've hit a wall. And quite predictably, the parents who are anti-vax are going to not have their children vaccinated. And we have pockets in this province, we have communities where the vaccination rate is as low as 34%. I wouldn't go anywhere near any of those communities. They are just disasters waiting to happen. And I don't think we're communicating honestly with our whole population about that. It's interesting, when the first cases of Omicron were detected in Saskatchewan as a result of travel, the first response of our chief medical health officer is to say nothing to worry about because, they were detected early and they're not going to, and no risk of community spread. Well, look around the world. Community spread happens. It just happens. There's no way you're going to prevent community spread. So we have to begin to enact public protection measures that assume there will be community spread, and it'll be significant community spread. And we have to get on it.
Yeah, thank you so much, Dr. Kendel. There's a lot of information shared there, and just about, like what you said, it's picking up on that communication strand if there's one thing we know about this is that, knowledge is empowerment if we can share it in a good way and share it relevant and evidence-based knowledge. But when it gets into the twists and the curves of what we see sometimes out there, even including some of the comments that make their way onto shows like this, in terms of trying to suppress some of the things that, we're very much discussing on, by not listening to the science and to the experts such as yourselves that's on this panel, it starts to dilute that. And as you say, you get that fatigue factor, and then people start to tune out, unfortunately, it's sad to see that. I'm really, really appreciating this round. There was a question that was put into our panel chat here, so I'm going to hand this over to Anika now, and she's going to follow up on that. So Anika, back to you.
Perfect. Thank you, Lenore. So now we'll take a question from one of our audience members. It is from Kelly Moore, and she is asking, with the holidays coming, what would the panelists recommend in terms of gathering? Would rapid testing before gathering for the holidays help? Are the rapid testings as accurate with the new variant? So first, I'll go to Dr. Kendel.
Well, I do think it is wise to use rapid tests prior to coming to a gathering. Pamela spoke about that, and I would recommend that. They are quite readily available now. Each of those packs has 5 test kits actually within it. And, it's not foolproof, but it is another layer of protection that obviously if you were asymptomatic and you got a positive rapid test, you stay home. And so that's one protection that I think we ought to be using. I think Nazeem could comment more effectively than I about whether the rapid tests are as reliable in picking up Omicron. I believe they are, but I'm not an expert in that area.
Okay, I'll go to Dr. Nazeem.
No, Dennis, I think what Dr. Kendel was saying is exactly right. I think there are 2 things, I think, in addition to all the things that we have been doing since last March, in terms of public health protection, and so on. 2 things that I want to kind of pick up here again and kind of, lift up. One, we need to get our booster dose. It is so important. About 2 weeks ago, I wasn't sure I will be getting a booster dose. The first few days of Omicron, I wasn't sure that I will get a booster dose because we have this situation of vaccine inequity across the globe. Canada is actually the country that is been associated with the biggest vaccine hoarder by WHO and others. And many countries that are in the first world, in European and North American regions of the world, have enough vaccines. Each person probably had 3 to 4 doses, enough supply. But so many other regions of the world, African continent, the whole continent has an average of about 7% fully vaccinated people compared to 80%, in Canada. I mean, think about that, 7% versus 80%. There are some countries like Chad, Nigeria, the most populous country in the African continent, has a 2% fully vaccinated rate. So supply is an issue, in these countries, but also it is more than supply. It is vaccine hesitancy, lack of trust in the government, and just infrastructure, issues, just actually getting vaccines into people, all over, the country. So why is this important? Because variants can start anywhere. They can evolve, they can emerge anywhere in this world, and then it can spread so rapidly, to any other part of the world. So, and they just, and we've known this. So this is why I thought that I will not get a booster. I was talking to Catherine, my partner, about this. We a lot of talking about COVID-19 for the past 2 years. Who was trained at Johns Hopkins, School of Hygiene, and so we are in the same field, and we weren't sure we were going to get the booster dose, but I have an appointment on Friday. I can't wait to get my booster dose, on Friday. So getting a booster dose as soon as you're eligible is important, particularly if you're immunocompromised, if you're older, if you're working in the front lines. You need to get the booster dose. I am fully in agreement with Dr. Kendel when he mentioned earlier that we need to actually hasten getting booster dose to all of the everyone who's 18 and above. And I think we have a capacity issue there. Again, in this province, we have a capacity issue. We are vaccinating our children 5 to 11. It's slowing down, as Dennis was saying, and also we have to boost as many people as we can very quickly. So we have a capacity issue, and I think this is probably what is limiting it. In terms of gathering, I think that we have to keep our gatherings really small. And we have to make sure that we gather with people who we know are fully vaccinated and boosted if they were eligible to get a booster. And we have to have that conversation. I mean, it is past time that we talk openly and always, about our vaccine status, now about our booster status as well. And we need to, if we are inside, gathering inside, yes, ventilation, but also if you're gathering intergenerationally, you have grandparents, grandkids, and parents, all sitting around the dinner table. I mean, holiday meal table. I would wear a mask. Not when you're eating, but I would wear a mask during this holiday season, and we could still have a conversation. We could still enjoy each other's company, but I would wear a mask. And rapid tests are important. I mean, that is another measure that we have really underutilized as a country. Rapid test. Denmark, Germany were using rapid tests so much more frequently and better than we have. That's one way that actually this province is better positioned with rapid tests. 6 million rapid tests, were shipped to Saskatchewan, and we have 2 or 3 kits of these, and 2 of our children arrived home from outside the province within the last 4 to 5 days, and within the hour after they arrived, one took a flight from Toronto, and good time to leave the province, but not bring the virus. That is a key thing. Good time to leave the province. And my daughter came from Winnipeg yesterday morning by train, and within the first hour of them coming, we got that rapid test going, and then a second test within the first 24 hours. Why a second test? Because there are false negatives with rapid tests. It's more likely to have false negatives rather than false positives. If it is a positive, it is very clear that it is a positive, it's a positive test, and you will want to, you'll want to get a PCR test, to report that status, and also to ensure that that it is it is Omicron, and so on, and stay home. Rapid test, some people think rapid test doesn't work well when you're asymptomatic. That's not the case. Even when you're asymptomatic or pre-symptomatic, rapid test is a very good first layer, first screening device, to ensure, either rule out that you're not positive, or rule in that you're positive. So I think it's a very good test to do even when you're asymptomatic. In fact, if you're symptomatic, you shouldn't be taking rapid test. You should actually get a PCR test. That is a recommended procedure. So you will need to use your rapid test asymptomatically, and I would use this as frequently as you want to, before leaving to a gathering, before leaving your province. but also when you arrive to your destination, or you come back home, from having gathered with people. You want to ensure that you're not taking the virus inadvertently to a gathering, to a destination, as well as you're not bringing the virus, into your home, into your family. So I would use, in both of those situations.
Perfect. Thank you, Dr. Nazeem. Great information. And as you said, it's that added layer of protection, which always helps, and especially in times like this, holiday seasons, it's busy. People are meeting their families and friends. So yeah, great information. And now I'll go over to you, Pamela.
I would like to calculate how much of my life I've spent in the last 2 years searching for the mute button on different virtual formats. So, I don't have a lot to add to what Nazeem and Dennis shared, and I'm always, really humbled to be here. I think the one thing what I would like to touch on is those difficult conversations with family members and friends at the holiday times. And in my previous work, I was a social worker and, had lots of difficult conversations. And I think it's so important for people when they're looking at gathering to be willing to start to have those difficult conversations. As Nazeem mentioned, we need to talk about vaccination. We need to talk about where we are at. If we've had the boost, we need to talk about our risk factors. I think we need to be open about that. And we need to acknowledge that all of us have different risk levels. All of us have different risk tolerances, and we need to be respectful of that. And so when we think about those difficult conversations, I think it's really important to not going into the conversation trying to change someone's mind, but go into the conversation being open to what they have to share, but knowing what your boundaries are, knowing what you've decided for your family, and knowing what your risk level is for your family. If you are gathering with elderly people, if you're gathering with somebody who has some type of an issue, your boundaries need to be firm. And you need to be able to say firmly, you know what, in our family, this is what we've decided. We've decided we're only gathering with vaccinated people. We've decided that we'd like everyone to take a rapid test. And if the rapid test is positive, to follow it up with an appointment at SHA for a PCR test and to follow the direction of SHA. And this doesn't mean we don't love you. This doesn't mean that we don't want to continue our relationship with you. But this is where our boundaries are for this holidays. And I think that's a critical conversation for people to have. And, if you want to share your reasons that, what, my father has a health issue, my grandparents are going to be there, we need to protect them. But stay firm with your boundaries on what's important for your family. And it doesn't have to be, I've stopped having, I'm not a scientist, I'm not a medical doctor. I believe strongly in what the experts say. I believe in the expert guidance. And I'm not going to get into a conversation about what one doctor said somewhere. The conversations I'm willing to have is, here are the rules in our house. Here's what we're doing. And that's, I'm working hard to be respectful in those conversations, but I'm just really encourage everyone to be willing to have that difficult conversation, because it's hard and we don't want to upset people at the holidays. We don't want to offend anybody. We don't want to hurt anybody's feelings, but this is the health and well-being of your family. And that's what's critical. This is the health and well-being of our society. And so I think we need to set respectful, firm boundaries about how we're going to proceed with the holidays, and then follow through on those boundaries. And that doesn't mean severing ties. That doesn't mean severing a relationship. It means you're going to change how you have that relationship. And that's, I think, what we all need to think about doing this weekend, heading into the holidays, and also having really good thoughts about how we're going to set up that holiday. I think Nazeem has mentioned some of the layers of protection we can have. These critical conversations have to be happening now, not a day before. They have to start happening now.
Perfect. Thank you so much, Pamela. Very well said. Before I pass it on to Lenore, I would just like to read a couple comments from audience members. First is from Peter. He said, grateful to you all for this. There cannot be too much information, and every day we need to listen and share firmly and hopefully. Thank you. So thank you, Peter, for that comment. Another one is from Carolyn. She says, those testing suggestions were awesome. 3 tests, 1 before you leave, 1 24 hours after arrival, and 1 when you get back home. Thank you. Thank you, everyone, for those comments and feedbacks. Over to you, Lenore.
Yeah, thank you so much. And yeah, just such good wisdom coming from you guys. I just feel honored to be part of this. Thanks so much, you know. And I mean, we know that this is the long haul for all of us, right? We're in it as a world. That's the thing that is, you know, wrap your head around that. If we think there's not fatigue happening with each one of our core beings, it's there because we're all in this together. It is the one thing that is pulling our world together. There are other things, but this is a very topical, significant, impacting, and has the ability to impact us in the most core of our being, in our essence. So it's important we're having this conversation today. I want to zoom it back out, but out again, because I know there's been lots of comments that are out there around jurisdictions and the politics and all of it, and it's messy as heck. And it is confusing. And so, you know, Dr. Kendel, I'm going to come back to you because I want to get your thoughts on, you know, while other jurisdictions seem to be tightening restrictions and others aren't, why are there these differences? I mean, I get this question all the time. Lenore, I don't know what you're talking about. You know, I look at this province, they're doing this. This guy's opening the doors up. This one's not. This one's saying nothing, you know, and it's like, so why should I do something if I'm not hearing it at that layer? What do we need the listening audience to be thinking about when all of this is coming at us?
Okay, well, before I respond to that, I just want to say I really appreciate that comment from Carolyn. She's a nurse who does contact tracing in the community.
Yeah.
And I can just imagine how stressful it is often for people to try and get, you know, people to comply with the requirements when they have tested positive. So the dog's breakfast, I would say, a public policy across Canada on COVID is going to be the subject of many, you know, political science research papers going forward. If you look in Canada, for the most part, the Atlantic Canada provinces have probably done the best of all the provinces in terms of controlling COVID. And one of the observations I would make is that it would seem apparent to me that in most instances, the advice from their chief medical health officers and from other people with expertise in public health was accepted completely by their premiers or their ministers of health, and it became policy. And in the rest of Canada, we've had a very troubling experience, which we're going to have to examine. When Pamela talks about thinking afterwards what worked and what didn't work, we're going to have to rethink the working relationship between chief medical health officers and governments. For the most part, they are under contract to government, so it's not surprising that they have accountability. But in all honesty, in many instances, I feel that our chief medical health officer has been not as free as he ought to be in order to honestly share with us his professional opinion about how we should be managing this. At one point in this process, as you know, he broke down emotionally during a press conference, and because it's taking a toll on him personally. And since then, he's been unusually quiet, and that bothers me because he ought to be outspoken. I want to hear from him. I want to also just say that I talked earlier about how our healthcare system, you know, is stressed, and Pamela mentioned that, you know, if people get test positive, they can't go to work. And so I do certainly worry about the fact that if this virus, this new variant, is as transmissible as it is, if we took out even, say, 5 or 10% of our healthcare workforce because they are positive, we're hooped. We already are running so close to the line that there's no reserves left in our system. And I also have heard from nurses and physicians and respiratory therapists and others that they are perhaps not going to continue their careers as they have followed them so far. It's taken too large a toll in their life, and they want to reposition themselves in terms of their future work. So I found it interesting when, we had this proposal last week that we were going to burn off, the surgical wait list by creating all this private capacity. Folks, there's no staff out there to just pick up. They're not sitting on the sidelines waiting to get a job. We are in a very tight human resource supply situation in healthcare. And so I do hope going forward that we can get better support, I guess, for our healthcare workforce.
Mhm.
Just even, a little bit more acknowledgement of the sacrifices they have made in their personal lives in order to carry on through these difficult months. The SMA has done a good job of telling some of these stories for physicians. I've seen some do some of that for nurses as well, but there's many, many other workers who haven't really had their stories told. I just want to say, regards getting the boosters. As a physician, I got an email today from the SMA asking all physicians to please consider increasing their arrangements to offer boosters. Of course, they'll have to get the vaccines, but I was glad to see that because we need to harness all the possible options for getting boosters. So you may be able to get it more readily at your family doctor's office.
Yeah, thank you for that, Dr. Kendel. And what I'm hearing you say is that, this is the time to really be sharing the evidence base and sharing that and seeing that in action. So I hear that from you. Nazeem, picking up on that, Dr. Muhajarine, like picking up on what you're hearing Dr. Kendel saying.
Yeah, as we all know, today we heard a policy directive, policy measure coming out of the federal government. This is about non-essential travel, people traveling into Canada, as well as people traveling, especially outside of Canada, Canadians traveling outside. So I was given an interview earlier today about travel during this time, during holiday season. Does this travel restrictions, work? Are they evidentiary, as evidentiary based, evidence based? I think that what these measures do is reduce volume of people traveling. Again, it's not a very sharp, a very nuanced and a sharp measure, countermeasure to minimize spread and so on. But it is a place to start. Does it have a lot of evidence? No, I don't think there's a lot of evidence. It's difficult to do studies, that compares countries, with and without these kinds of very broad-based measures that restricts travel of citizens and people, guests come into their countries and so on. But we don't have to look very far other than our own Atlantic bubble. In earlier part of the pandemic, we had an Atlantic travel bubble, and it worked very well, I would say, kind of retrospectively, even prospectively. It worked okay, but there were other reasons as well. But it was part of these layers of measures that these four provinces decided to do. But there are evidence of this in other countries as well. New Zealand and Australia formed a bubble, travel bubble, early in the pandemic and so on. So coming back, I think it reduces the volume of travelers, which is probably a good thing. But the nuance measure has to be backing that up, is to test people when they cross that border. That is what we need to do really well. We need to be very diligent, very comprehensive, supporting people to quarantine until their test results, are returned, and be very, talking of communication, very clear about all of that. Even definition of what is essential and non-essential travel Really shouldn't be up to individual people to decide. There should be guidelines of what is essential and non-essential travel. My niece got married on December 6th, and this was a wedding that was planned about a year ago. It didn't happen, but it happened in Sri Lanka on December 6th. Someone very close to me, and there wasn't a question that I would go. It wasn't possible. So I watched it on a live stream video. I say these things because we all talk about in panels like this, but also we live the life during the pandemic. All of the things that we say tonight, I am living it. I don't know about anybody else. I am living it. I am getting my booster dose. I am foregoing all kinds of travel that I've decided they're not essential to happen at this point in time, because I put my health, my well-being, and those around me in my family right at the top. There will be other holidays. There's always holidays. I want to live through this holiday season and well, in order to enjoy the next year's holiday season. So I think these policy matters really are really important, and I think I think I'll stop there, just in terms of that travel measures. And I think the testing is the key thing there at the border. And the testing is also when you travel domestically within the province, but across province, within the country, across provinces. As I said earlier, rapid tests, a PCR test, these are important when you're traveling within Canada and across borders as well.
Yeah, thank you for that, Dr. Muhajarine. Yeah, much appreciated, Nazeem. I mean, there's just so much more that we can talk about, but we want to also respect and honor people's time as we're going into the holiday season here. Pamela, I want to go back to you. You spoke to our hearts, in terms of boundaries and the family chats that are happening right now all across Saskatchewan. I know it. I know of friends that have been stressed out because they've had some tough conversations that have happened, and other ones that haven't happened. They don't even know how to start it. So I appreciate how you were able to give some wisdom there in terms of saying, it's about putting out there what is important to you and your boundaries and what you need in terms of mitigating your risks and risk extension. What are some other words that you have when you hear what your colleagues have just said at that kind of higher level, and you're working on the ground level, working from an emergency planning level? Like you're the response team to these guys saying, okay, we need to put all these guidelines in here. But if those guidelines are there or not there, you got to figure something out on the bottom about what to do. So just some final thoughts on that before Anika goes to a closing round here.
So I think one of the things that we've learned, and so in our EOC, we have 3 questions every day. The first is, who are we forgetting? What are we forgetting? And who haven't we talked to? And, we do that review every single day, and we find something. I think one of the things that I've learned in my experience is the only way I'm getting through this right now, and the only way a lot of us are getting through this, is I need to chunk it down to what can I control and what do I need to focus on right now. It can be very easy to get overwhelmed by all of the talk, all of the everything that's going on around you. And so there are days where the only way we're getting through the day is what's the next meeting, what's the next decision, what do we need to, what is in my control right now. I will share in a very respectful way that I work really hard and I work really hard on not following a lot of social media, not following what's going on in the news. I need to know what I need to know to do my job, and I get that information from the experts. But I turn it off. There are times where I need to turn off COVID because I need to live the rest of my life, and I need to be healthy and happy for my family. And I think there are some key things that we work on in our EOC around how we keep our EOC functioning, how we keep our critical partners functioning. And one of those is you get them the information they need when they need it. And the other one is that we work really hard to be respectful of each other's time And so if one of the people in our EOC or our team is off for the day, we do everything we can to not bother them that day because they need that day. And so I think, what that means for me in a community and family point of view is there are times where we need to be well informed and we need to go to the experts to get that information. And there's times where we need to turn it off and go tobogganing and go skating and do all those wonderful outdoor things we can do with our families and focus on those joyful moments with our families. Because if we're constantly living with this and never turning it off and never taking a break from it, it's overwhelming. And it'll be even more so, and we will not be able to function. So, what do we need to do to move forward every day? And I think chunking it and turning it off when we can is critical. And I'm going to really, one of the things I believe strongly in is when I think about children and I think about youth, it's really important that we model that behavior for them right now. And that we model for them that this isn't the only thing we talk about. And I've learned that lesson. Like, that's been a tough one for me. I'm from work and I want to talk about work, and guess what's at work right now? But I think it's really important for us to help model that behavior for children and help model how to manage this healthily. I think the biggest indicator for how kids will do is how their parents manage this. And if parents are managing well, if parents are role modeling well, kids will be just fine. They're amazing how they can bounce back. And I think I'm just thinking of the amazing lessons our kids can learn from this pandemic. They can learn that being in a community matters, and being in a community is about responsibilities and not just rights. They can learn that we can have hard conversations with our families, and we can have difficult conversations with people and still love them and care about them and still have a relationship. That a hard conversation, an argument, is not the end of a relationship. It's part of a relationship. And so I think all of these things are critical as we move forward. And I think one of the things we work really hard on in our EOC is bringing in the human factor, because it's very easy to focus on the technical stuff and do all the technical stuff, but we have to be able to speak from the heart and mind to our staff members and to our colleagues. And so that's what we'll be focusing on.
So well said, Pamela. Just thank you so much. You're helping us on this panel. You're giving us some really wise things. Turn that darn phone off, throw it away for a bit, focus on the immediate, put your boundaries where they need to be, and have the honest conversation in good ways, drawing from the experts and turning the experts off when you can too. So speaking of those experts, though, they're here. So I'm going to hand it over to Annika so that we can do a final kind of closing wrap up here. And just want to thank everybody that has tuned in and who will be tuning in. And we just know how important these sessions are and how they're shared within our community. So just thanks so much. These are the kinds of things we want shared, and less of that other thing that we're talking about today, for sure. So Annika, back to you.
Perfect. Thank you, Lenore. So as part of our wrap up, what is the message of hope you want us to take with us into the holiday seasons? So I'll start with Dr. Kendel.
Well, my message of hope is one that hinges on the welfare of all our citizens. And I could just say platitudes and say, have a wonderful holiday season, but I do want to leave one message. I've been privileged to serve in a variety of leadership roles, and I teach and mentor leadership. And one of the principles of leadership that I've always remembered is that to not decide is to decide. When you're in a leadership role and there's a critical issue that you have to decide, putting it off is never a wise thing to do. If you do make a decision, explain why you made the decision. We all make errors. We can learn from our errors. But I guess my hopeful message is I'm going to reinforce my hopeful request to our Minister of Health and our Premier to make some decisions and communicate those decisions to us quite promptly. We need that. Thank you.
Perfect. Thank you, Dr. Kendel. And now Dr. Nazeem.
I've been reading one of the very articulate and very analytical writers during this time. There have been many, I think. Thomas Perriot, who introduced us to the metaphor of hammer, and so on. His latest article is about Omicron, the question of Omicron. I think it was titled, I'm just reading it this past week. So he reckons that that this particular variant, Omicron, is probably, we like to think that it is the last SARS-CoV-2 virus that's got, and it is actually packed a punch. It put everything that it had into this one variant, and it is kind of giving us all it's got. And I would think that as humans, that we are up to par. We will rise up, and we will respond in kind. I'm anthropomizing this, but anyway, we will respond in kind, and this will be the last of this concerning variants that we would face. And next year, in 3-4 months time, that we will be in a sustained period of decline of COVID-19, in this world. It wouldn't disappear. It wouldn't disappear. It wouldn't disappear in a hurry. In fact, 2 generations from now, probably will have some of this circulating, but we will actually be able to live with it, hopefully soon. So I hope this Omicron is the last we'll see of this kind. And in nine days, we'll have Christmas Eve, and I'm going to just hold on to my own family a little bit closer, a little bit more meaningfully, because we have seen it through. We are seeing it through, and that is what actually keeps me going. So.
Perfect. Thank you, Dr. Nazeem. And now over to Pamela.
Well, great. Thank you. And thank you to Dennis and Nazeem for their messages of hope. My message of hope is that I'll share first that when Omicron came and when we were hearing about it, I have to tell you, I was pretty exhausted at that point. And, some of the first information I received, and I'm lucky enough to be able to receive information behind the scene and from different experts. And at first I was pretty like, oh man, not sure we can do that. Not sure I can do this. I think we can do this. I wasn't sure if I can do this. But then I go back to what can we do? And in looking at the things we need to do about Omicron, these are things we can do. These are things we know how to do. These are things we've got in place. We maybe need to extend. We maybe need to reconsider. But these are all, there's no rocket science here. Is just decisions need to be made and we need to do it. And I think that's my hope, is that it's not March 2020. It's not that we don't know what to do. It's not that we're all trying to figure out, how much toilet paper we need. We know what we need to do. We know we need to mask. We know we need to be fully vaccinated. We know that we need to have ventilation. We know that we need to have smaller gatherings. We know what to do. And that's my hopeful thing, because I think the hardest part is the unknown, and we know. And so it's the decisions to do it, and it's the wherewithal to do it. And so I think we can do that, and we really can. And the other thing that keeps me hopeful is, when I look at, we conduct these mid-action reports all the time and after-action reports. And the thing that strikes me in Saskatoon is every time we do any kind of a mid-action report, and every time I review what we've done in COVID and where we've been, is in Saskatoon, we work well together. In Saskatoon, we have great partnerships. In Saskatoon, I cannot say enough about our medical health officers here in Saskatoon, and a big shout out to Dr. Hasselbach and Dr. Capage and Dr. Hortense Tabian, Dr. Opondo. They work in partnership with us all the time. I think of the number of times that our medical health officers in Saskatoon have volunteered to speak to our city council in an open council setting in public, in being recorded, that everybody can view and share where things are at. That's extraordinary. It really is. I think of all the times that we've asked them to participate and share information with our critical infrastructure partners or with the people, the teams leading the vulnerable sector. And every single time they've stepped up to bat, every single time. And so that brings me hope. We can do it.
Perfect. Loved all those messages. And now over to you, Lenore.
That was so sweet. Pamela, thanks so much. I mean, truly, what a thank you. You're bringing tears to my eyes here, I tell you. So I feel what you're feeling. That's for sure. I want to just thank everybody for participating in today's panel. It matters. We know it matters. If we reach out just to one person, it matters. And we're doing that. And I know we're going to continue to do that by doing these panels and having the wonderful guests that we have in each of you. Pamela Goulden-McLeod from the city of Saskatoon, Dennis Kendel, a health consultant here who has, and advocate and a whole bunch of communications that he does with respect to this. So much appreciated. And Dr. Nazeem, Muhajarine as well, just for all of your communications that you've been doing through all of this. And I know each one of you have been taking the hits for this. So self-care for yourself as well. Make sure you put your boundaries up as well. That's really important. And make sure you tune all of us out too, so that you can enjoy some of that precious time with your families too. I want to thank my colleague Anika, and behind the scenes Ian and Dennis and Deb from No YXC, Voice of Saskatoon, and to all of the community people out there that are doing all the best things, taking the guidance and the advice and the health protocols to do all the things to be safe, to be able to enjoy a life, and to be able to continue having a good, healthy life. So take care, everybody. All the best of the holiday season, and Happy New Year to everybody.
Happy holidays.
Yes.